Assalamu alaikum. Uh, Inshallah, let's start the program with recitation of Holy Quran. Bis- Bismillah ar-Rahman ar-Rahim. Kul huwallahu ahad, Allahu samad, lam yalid, wa lam yulad, wa lam yakul lahu kufuwan ahad. So, brothers and sisters, uh, this is a presentation by the medical committee of the MCMC, and it is related, of course, to the coronavirus. Basically, we are trying to give the update and what's going on these days, and basically, it's more of an educational program with the education and instructions. We have here with presentation Dr. Ahmed Moore. He is a specialist in internal medicine, and he is also involved in the policy making about communicable diseases, including the coronavirus. Then we have Dr. Mushtaq Maiman. He's also an internist and specialist in internal medicine. We have Dr. Mateen sitting in the back. I asked him to come in the front. He is an ER physician, so he may be seeing the coronavirus patients to start with who come to the ER. We have Dr. Amir Hussain, and he will also help us answering questions. So basically, we know a lot about what to do, what not to do, but again, there are many things which our doctors will. Dr. Umar is here. So there are lots of doctors, mashallah, and I'm also a doctor, small doctor. So, so we'll try to answer as much as questions as possible. But there are many questions which are still not answerable at this stage. So, inshallah, let's begin the program, and Dr. Ahmad Moore will start his presentation. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillah ar-Rahman ar-Rahim. Before I start, I just to make sure that this is an educational program, has nothing to do, no relationship to the masjid or the school. This is just education for the public. So you use it for your personal consumption. Has nothing to do with policies or anything related to the masjid or the school. Just making it clear so there is no confusion. I want to, before we start, let's talk about what do you expect to see or learn from this. The coronavirus is something new. Scientists don't know much about it yet. We're still learning about it. And the reason why it is confusing is because we don't have all the information about it. So there is some guessing about what is happening to some degree, even between scientists. Therefore, you are not going to have solid information which is going to answer everything. You are going to have enough information to help you deal with day-to-day activities in your life. So we are going to streamline the information which you have, because the internet is full of information and misinformation, and hopefully will give you an idea what is real, what is not real. And that is a difficult piece as well. But you really, if you want to have information, you need to go to the right resources. I will give you some of these resources, because nowadays with the internet and Facebook and WhatsApp and so on, anybody can put information there, and it might or might not be true, and you have to be very careful when you are using this information. So we want to provide you with reliable resources of information, not information which can be, so it is the real facts which is available to us at this time. Hopefully, once you know more, your anxiety will be a little, I mean, there's a lot of anxiety about this illness in the community all over the world. So the more we learn, the more hopefully we'll know that it might not be as bad as it looks. And we want to give you ideas how to control the infection, how you can prevent, and hopefully how you control, not how you, but how we as a society or as the world as a whole will be able to control this infection. So what is coronavirus? Coronavirus is not new. As a group of viruses is not new. It actually existed in animals for a long time. In fact, there were outbreaks in the past. I'll talk about them in a minute. The word novel means new. Novel is a new something which has not been found in the past. We are learning about it now, and that's why this virus it did not exist as far as we know in the past, and it seems to have come from the wet market in China, where in I guess Wuhan province. In the wet market, what happens? The meat and live animal are sold in the same place. So of course, if you have a live animal, probably will communicate the viruses and bacteria and so on to the food which is being sold. And it seems that that's where it is started. Of course, there is no scientific evidence to prove that, but this is the assumption. It started in the wet market in China, and this is where the illness actually started. The coronaviruses, as I said, actually they exist in animal. Sometimes they go in, that they're transported or communicated to humans. And generally speaking, coronaviruses cause what is called a common cold. So common cold, some of the causes for it is coronavirus. And it's usually it's in the animals, but as I said, it can be sometimes it transferred to the human. This virus, it seems to have come from something called horseshoe bat. Actually, most of the coronaviruses seem to have come from bats, and this is the picture of the animal which seems to have been the cause for it. I'm sorry? Okay. So there were previous coronavirus incidences in the past. Everybody is aware of them, but we don't think much about them. The severe acute respiratory syndrome, which happened between 2002-2004, there were a total of 8,098 cases reported, confirmed. Out of them is a very high proportion of death, actually, 774. That's a very high percentage of death. The Middle Eastern Respiratory Syndrome, 2012, it actually is still happening even now, but until 2019, there are 2,998 cases. Out of them is 811 deaths. I mean, that is a very high percentage, as you can see. The good thing is the total number of cases is small. So although a lot of people die from them, but the total number of cases is small. Now, I just want to go through a little thing so you hear the words epidemic, outbreak, pandemic. Epidemic is essentially when a rapid spread of infectious diseases affect large number of people in a given period, in a short period of time, usually less than 2 weeks. That's what the epidemic. It spreads very quickly and hopefully subsides very quickly. Outbreak is usually a sudden increase in occurrences of disease in particular time or area. So it does not have to be in 2 weeks. It can be longer or shorter than 2 weeks, the outbreak. The pandemic is essentially when it affects more than a few countries or more than a few continents. Usually the whole world, it spreads through the whole world nowadays. How does what does actually, let's start with the word COVID-19. What does it start? CO is corona, VI is virus, and D is disease. 2019. So that's what it stands for. It's really not science. So how does it spread? The most common spread, it seems, is the respiratory droplets. And the droplets is when you cough and sneeze, small bits actually spray around you and up to 3 to 6 feet, and these contain the virus, and usually they drop on furniture, on tables and chairs that people touch it, or it can even come to the face directly and so on. And that seems to be the most common cause for the infection at this time. The next cause is contact. It could be contact with furniture, it could be contact with an infected person. This is, again, what happens is you touch a surface which has the virus, then you rub your face, including the eyes, not only the nose or the mouth. Even if you rub your eyes, it can be communicated through the eyes. That is the second most common way of communicating. It seems that way. There is variation in how people present this issue. Aerosolization. is actually like a group of you here. If one person is infected, this is less likely. It's not common to have it through this process. It's actually while you are normally breathing, not necessarily sneezing or coughing, some of the virus actually goes out with the air back and forth, and it can spread to the others. Usually it's not the way it actually communicated. So, but you want to stay away from people who are infected anyway, at least 3 to 6 feet, in case they sneeze or cough. But this is another way which it can be communicated. Sorry. So what makes this virus different than the others? I mean, we had, as I said, we even had coronavirus. We had the Spanish flu. We had the bird flu. We had everything, and we were scared, but not to this degree. And part of that, as I said, this virus is not really known until now to what it is in details, even by the scientists. One thing about this virus, which is unique to some degree, it happens to others, but this is a little unique to this virus, it seems, that the incubation period, they say between 2 days to 14 days. So you can have the virus, you carry the virus for 14 days, and in some reports, actually 24 days, without actually without being symptomatic, without showing any signs of illness, which means during that period you are spreading the illness to the others without knowing. So one of us who is healthy now can be spreading the illness. That's, I believe it's not unique, but not usual for spread of the disease when you are healthy or apparently healthy, that you are spreading the disease. But this one is one of the viruses which spreads that way. So even if you don't know that you have an infection, you are spreading the disease. The next one is the asymptomatic infection. It's very frequent with this illness. Actually, a lot of people who get this illness don't even have symptoms. So they can have the illness and still don't have the symptoms. And that is, they communicate the illness without even realizing that. This virus seems to be frequently mutating, which means the mutation means it changes its character. Why that is important? Because first of all, every time it changes its character, the body immunity does not recognize it, because when your body is exposed to a virus or bacteria or any foreign agent, it actually formulates what is called antibody to fight that agent. Now, once it formulates this antibody, it will recognize that agent and try to fight it. Now, if that agent changes itself frequently, you can get infected again with the same virus without even if you had been exposed to it before. And of course, it makes it harder to get a vaccine. It makes it harder to get a vaccine because the virus keeps changing, and the vaccine is actually forming antibody against the virus. And if you cannot form the antibody against the virus because of the mutation, then it cannot be, you cannot be immune to it. The next is that, of course, as all of us know, that we don't have vaccines. There is lack of vaccine for this. And even if they are going to develop a vaccine, first of all, they have to sort of study the virus and isolate the proteins in the virus. Then they have to test those into animals. Then they test them after they find that it is safe. They test them in a small number of human beings, and then they test them in a larger number of human beings. So you are talking about, I mean, in the best case scenario, you are talking about a year, maybe a little less, but not much less than that. So during this episode, we won't have a vaccine for this virus. Of course, we don't have any antiviral therapy. There is no treatment available for it. There has been mention of chloroquine recently. It is a malaria drug, is an old drug. Some people, they say it might be a little effective. It's being studied as one of, it's not antiviral therapy, it's anti-malarial therapy. And although there are some indication it might be effective to some degree, probably it won't, because it's not meant to fight viruses. Why is this virus more dangerous than the other coronaviruses? It's because its affinity to the lower respiratory tract. Let me explain that. So the virus actually is a sort of coated protein essentially, or coated amino acid. a chain of amino acids. So it attaches itself to the cell. It goes to receptors, attaches itself to the cells in the body, and make that cell produce copies of that virus. Now, usually what happens, the affinity of the coronaviruses is for the upper airways, the nose, the sinuses, the throat. So that's why you get a common cold from them. This particular virus, its affinity is actually to the lungs, and that's why it is dangerous. It goes to the lower part of the lung, where its receptors are, attaches itself to the receptors, and causes a condition called ADRS, acute respiratory distress syndrome. ADRS, acute respiratory distress syndrome, which is usually many times lethal. And actually, the treatment has improved recently, but it is usually lethal, where the lungs become essentially a white material. The other thing is, because this is a new virus with no experience in human beings in this virus, there is something called herd immunity, where if you have a vaccine for a virus, or there is a lot of people who have been infected by the virus, the community as a whole becomes immune. Since this is a totally new virus, there is no herd community, so everybody is susceptible. And there is indication that it's probably going to affect somewhere between, I think, 50 to 75% of the human beings, which is a large number. So what are the signs and symptoms of this infection? The most common is fever and cough. Sometimes you get other symptoms like sore throats and so forth, and headaches, but the most common is fever and cough. There is the other sinister sign is actually shortness of breath. When you get short of breath, that is a bad sign, and you really need to seek medical help. And that's what I talked about, patients being asymptomatic. They have the infection, they have no symptoms, to the extreme, which is the ARDS, acute respiratory distress syndrome. So this is where it becomes very serious and people die. It also causes what is called multi-system failure. Other than the lungs, the most common organ which fails in this infection is the kidneys. So it can be very serious, where it can damage the lungs and the kidneys, and of course, following that, persons have the people will have more organ failure, and a significant number dies. Let me go back about the significant number dies. Actually, the percentage of death for this virus is, they say, it varies where you're looking. It's different where you're looking, what source you look at. But it is between 2 and 4, and that is significantly higher than the flu. And the reason probably why we diagnose more cases of the flu when they are infected as compared to this condition, which people can be infected, but they are not diagnosed because they have no symptoms. And therefore, the proportion of people who are dying compared to the people who are diagnosed is significantly high compared to the flu and other illnesses. So what can we do? I skip a slide. What can you do? First, let's go for the diagnosis, excuse me. So the diagnosis is usually there was a delay in actually developing kits for diagnosis this virus, but the kit which is available now is a nasopharyngeal swab. They put a swab into the nose, into the pharynx, the back of the throat. They take a culture, they take a sample and send it to the lab where it is tested. And since this virus actually more likely to affect the lungs, the sputum seems to be a better way to diagnose it. And there is a way to diagnose it also through CT scan of the chest. Now, what can we do? That's ultimately what everybody wants to do. Most important thing you really can do is frequent wash of the hands. Nobody can emphasize that enough. If you want to avoid contacting this illness, you really need to wash your hands frequently. And washing your hands just with water, it won't work. You need soap and you need to wash it for about, if you want to kill the virus completely, you need to wash about 20 seconds. So you need to wash with water and soap for about 20 seconds at least to be effective. And that seems to be the most effective way to try to avoid having contract the infection. Now, as an alternative to washing the hands, hands wash is probably best, but you can use the hand sanitizer, and you make sure that the alcohol contact is 60% for it to kill this virus. So I think, again, I know talking about alcohol in the masjid might not be appropriate, but this is a way to actually kill the virus. We have, and it I guess can be used. We need to be very thorough. We need to clean surfaces frequently and use disinfectant if possible. All surfaces, all the areas, especially the most common, by the way, area of contaminating this virus is door handles. So if you can clean the door handles frequently, that will be very helpful. Tables, chairs, and so on, and other furniture is important as well. For the people who are more susceptible to have severe illness are people who are 60 and over and who have other health issues, diabetes, heart disease, high blood pressure, kidney disease, and so on. They are more likely to have complications. Actually, most of the people who died, they have other health issues. So if you want to avoid, especially for this patient group, is not to be in a crowded area if at all possible. Avoid contact with other people who have symptoms. So somebody coughing and sneezing, it might be just benign condition, but it might be better for you to actually avoid them if that's possible. And what you can do yourself is always remember, you need to cover your cough, and don't cover your cough or sneeze with the palm of your hand. That's not the best way to do it, because the next thing is you are going to shake hands with somebody and give them the illness. I think using a tissue will be appropriate, or you can cover it with your elbow. That's the easiest and the quickest way and the safest way to do it, covering your cough and sneeze with the elbow. Infected people, actually, they can do a favor to the community around them if they stay home. Not necessarily infected, people who have symptoms, people who have been exposed to other people who have the infection. Maybe it's better for them to stay at home as much as they can. What is self-isolation at home? I think if you have symptoms, you really need to stay in an area away from the rest of your family, and it can be effective if you can do it. You can stay in a room alone, away from them. Don't mix too much, don't share too much, supplies and tissues and utensils and so on. I mean, I don't want we don't want to be going too far, but I guess if you can use a towel to open public places, to open the handles of the doors, is actually something, it can be helpful, because these are the most common areas where the virus is contaminated, because everybody they have to hold them to open the door. Now, this is something I want to mention, but I'm not sure if it is doable. For example, handshakes it helps if you don't shake hands. Kissing, the Arabs like to kiss, like I put here, and they kiss each other, right? That's probably dangerous, and hugging as well is probably, well, I'm not sure dangerous, but it's social behavior. We do it. Are we going to be able to avoid it? I don't know. So if somebody puts their hand to you to shake your hand, are you going to run away from them? Doesn't make sense. Now, what institutions can do, like companies, masjids, churches, all these places, I think they need to supply ample of hygienic supplies. I think that will be helpful if they have alcohol wipes, alcohol sanitizers around the facility. That will be very helpful. It minimizes the communicating the disease. frequent deep cleaning, and that's actually many facilities do implement that. They start implementing that, which means they actually deep clean, like use a disinfectant and make sure all the handles, all things which are handled frequently by their staff are cleaned frequently. That's something I think all institutions should. Any area which is being used frequently by the people who are present there, it needs to be cleaned all the time, maybe like every 3, 4, 5, 6 hours. And the more cleaning you do, the less likely that you are going to communicate the illness. Now, social isolation, what is social isolation? So if there is, let's say, this group, if we are going to do a social isolation in this group, we'll put a table over there, and anybody who has symptoms of cough and sneezing and fever and headache and so on, they go and sit there. Is that bad? I don't think so. I think something we can do. I think even like in churches or masjids and places, they can probably provide an area for people who are having symptoms if they insist to come there. However, I think the best thing they can do, the people who have symptoms, is not to come to gatherings like this. That's the best thing they can do. The other piece which I think we need to keep doing and continue to do, I'm sorry if I went beyond my time, but I think the training and education like we are doing now, but the more we know about this virus, I think the more we can educate the people, and the more we know, the less anxious we are. So we need to continue all the time to educate, because getting information through other sources increases the anxiety, and it actually has negative outcome on the community as a whole. And of course, we always have to follow recommendations of appropriate authorities. That will be the government, the CDC, the World Health Organization, and so on. We need to follow them and make sure we follow any recommendation they have. Sometimes there might be an outbreak, like in Japan, they closed our schools, and that's a decision made by the government. That's what we need to follow, and if they recommend such a thing, we need to follow that recommendation. So if I get sick, what should I do? I should stay home. That's the most important piece. So I think, I don't know, I'm not passing fatwa, but I think if people can, I know I don't want to say it, but if stay at home and pray salah at home. Allahu alam, I don't know. Allahu alam. But if really they are sick and they think that they might communicate it to the others, they should be careful. I think, I don't know what the Islamic answer to that, but something to think about. And hydrate yourself, of course. The only thing you can do really is drink a lot of fluids and lots of rest. I talked about self-isolation in the home, and that is, it can, believe it or not, can be effective from preventing you spreading the illness to your family around you. Now, if the symptoms worsen, and especially if you start having shortness of breath, you really need to call. I did not say, I said call your healthcare provider. I did not say go to them, because sometimes they will tell you to actually go to the emergency room if they don't think they can handle your case. And that's very important. So don't show up in the doctor's office unless you call them and they agreed to see you. Now, the current status actually, as of about half an hour ago, you have 106,000 cases, 3,571 deaths, and 58 have already recovered. There is 43,000 who are actually still suffering with the disease. And this is the status in the USA: 437 deaths is 17. New Jersey had 4 cases. Now, as I said earlier, I mentioned the resources, the World Health Organization, Center for Disease Control, and this link actually, if you go there, I think it will show you the current status. Here they are. So it actually counts the number and so on. Thank you very much. Stay healthy, and inshallah, it will not come close here, but you know, the fact is it's going to affect everybody somehow. So we have to be prepared for it. Assalamu alaikum. Hand wash is still is the same. I mean, that's very important. Can you communicate it through food? Yes, you can, of course. And if you, it's like the food is a surface. So if you have a piece of bread and you touch it and you give it to me to eat, it will have the virus. So even if I did not eat it, if I touch it after you, I can get it. Sure.
Jazakallah khair, Dr. Ahmed Moore. Thank you for your very well prepared presentation and very informative one. So we'll open for the questions and answers. And obviously, we don't have a lot of answers, but all of our doctors here will try to do their best to answer as much as possible, as accurate as possible. So I think so. There are a few sisters. Sisters, do you have any question? Not yet. Okay. Thank you. Yes. Dr. Mati? No, press.
Okay. So, mashallah, Dr. Moore, jazakallah khair for the really good presentation. He had mentioned one point that you should not just go to your doctor's office, show up if you suspect that you have the virus. If you do that, you will expose everyone in the office, including your doctor, to the virus if you actually have it. So, piggybacking on that is the idea that you really shouldn't show up in the emergency department either if you just suspect that you have the virus or you want to get a confirmation for it. This is not the way to do it. The reason to come to the emergency department is if you would have gone anyway. You're having trouble breathing, you're feeling very sick. Whether or not you had the virus, if you were going to go anywhere, then that would be a reason to show up. Otherwise, don't, because then you risk the same problem as to giving it to everybody when you go. New Jersey states, in fact, I think it's wide now. If you call poison control, they will direct you as well now. So the same number for poison control, you call them. If you have a suspicion that you might have the virus, then they will direct you. They'll ask you some questions about your symptoms, and then they'll tell you what to do next. So the whole thing is that if you have it and you can stay at home, stay at home. Don't go out and give it to other people who otherwise wouldn't have gotten it if you decide to stay at home. You just Google poison control. If it was a 1-800 number, if I told you, you probably wouldn't remember it anyway. Yeah. What's that? Okay. Sure. Yeah. If you are sick enough that you would have gone to the ER anyway, then you would do what you normally do. Call 911, go to the emergency department if you're that sick. But just if you suspect you have a cough, you have a fever, you have a runny nose, you suspect that you might have the virus, that if that would not have taken you to the ER, it should not take you to the ER for this either. They will, if you want to know what to do next, you call Poison Center, Poison Control, and then they will direct you based upon your symptoms what to do next. Rather than just showing up. We're having this problem where people are just coming to the emergency department and it's causing chaos. And we would appreciate that not happening.
Even also don't go to the doctor's office, call the doctor's office and they will ask you some questions if you suspect that. That's the main thing. All of the hospital and private practice there, we are getting notifying that's do not go to the doctor. So we have these symptoms, fever, cough, shortness of breath, cold symptoms, then call the doctor's office that I have these symptoms, should I come, and doctor will instruct you if it's, and talk to them before going to the office. Okay. uh,
So, uh, where's the number? Okay. So the number is 1-800-222-1222. 2222. Yeah, or 1-800-962-1253. So 1-800-222-1222 or 1-800-962-1253.
At this time, I don't think you should change anything except the hygiene which we talked about. So do everything you are doing normally doing, because the infection rate here is still low. It's going probably to be higher, but at this time it's still low. So you should function normally. However, you have to think about what you are doing in general. For example, the frequency of hand wash is very effective even if you are in the area where there could be an infection. Using hand wipes and alcohol hand wash and things that frequently, that will be good. Avoiding people who cough, not shaking hands, but I did not say that. I mean, I don't know if you can stop shaking hands. I'm guilty with that, but it's a way where you can minimize the spread. But the hygiene, essentially the hygiene. And the only thing really you can do is to frequently wash your hands as much as you can. If you want, you can carry a small bottle of the alcohol-based hand sanitizer, and you can use it frequently too. What difference does it make to you? you no, no. Once it goes into the sink, it's gone. Don't worry about it.
Is it more appropriate if you wash hands more? No, it's okay. More like multiple times at the same time, or doesn't matter?
No, 20 seconds to wash your hands properly. You have to. But the soap. Go.
You have
Not
to
20 minutes.
rub the hand with soap basically to that will kill the cell wall of the virus, and then it breaks down. Basically, you are killing the virus, and then you wash later on with the water.
The other aspect is the mechanical taking off of the virus. When you rub and wash, and so the mechanically the virus is gone off your hand.
But this is just the scientific wallahu alam, what exactly happens.
We haven't asked a virus what happens to the virus.
Any questions from the sisters?
Sisters, any question? No.
Acha. So I've seen that some people who got infected, they were treated and they went back home, and they are doing normal now. So what is the?
No, even without treatment, there is no treatment.
Mhm.
There is no.
I mean, I've seen it in the news, and some.
They are what they are talking about is what is called supportive treatment. There is no curative treatment. Curative treatment, when you, for example, have an infection, you get antibiotics. You are being treated for the infection. There is no treatment for it. All they do is supportive treatment, just to make sure they support you with fluids, with other like antibiotics for fever and things like that, until your body gets over the infection. But there is no cure as such for it.
So
There is no medicine.
so the fatality rate is not 100%, right? Even
Oh,
if
no. It's about two. It's out of out of each 100 diagnosed, the number who are not diagnosed is very high. But out of the people who are diagnosed, about 2 out of 100 die.
2%.
Okay.
And you have to be 60 and over. Oh, I want to add one thing. It's very interesting about this virus. It seems to be less likely to affect children. It's an interesting. It affects more of adults, especially if you are older adult. It seems to be like attractive to.
Any reason why it is not affecting? I mean, that's very good, Alhamdulillah. But any reason why it is not
Nobody
affecting
knows.
children?
No, there are a lot of things which are unknown about
Yeah.
this virus as of now. Nobody knows.
How come more men die from it but not the women? Is it
That's gender discrimination by the virus.
There's a reason behind, because I mean, what is obvious, men are more exposed to environment to go for work, and women stay. I mean, it may be higher in the Western culture because more women working. Other thing is that I just want to add, the more common people who are dying are who have a chronic medical illnesses like diabetes, especially the COPD, asthma, emphysema, who has already compromised the lungs, and that affects more. They get very sick and die.
That's
Is
true.
that right?
Just yes, just rest. They cannot do much. As long as, like Dr. Mateen said, if you have symptoms which you would go to the ER, you really need to go to the ER. Other than that, you stay home, drink fluids, and just sleep. And hopefully, it won't be. Remember, just keep in mind, coronaviruses, generally speaking, do not kill. This is a unique kind of coronavirus. It's novel, it's new, the human has not been exposed to it, and therefore it's a little lethal. But coronaviruses are around all the time. They are around in animals, sometimes they come to humans. We get common colds usually from them.
Incubation
No,
period.
no. Actually, I'm sorry, but some indication says it can be even longer. And remember, there are people who actually carry the virus and they don't show symptoms. So for that, you can say the incubation period is even longer.
when you say drink fluids means you can drink anything like soda, coffee, tea,
Soap.
or can
So
I said fluids. Fluids. It's any fluid. It has nothing to do with water. I did not say water. I said fluid. You like soda? Drink soda. Yeah, drink soda. You want kahwe? Drink kahwe.
that's what's the point.
I'm going to actually. Okay.
Sure.
So okay. To,
Yeah. Yeah. Can you repeat the question, Dr. Moore?
the question is how long is going to last, and what about the travel in the summer, and whether it's going to improve in the summer or not. So about the duration, is nobody can tell you, of course. They say after the weather improves, the incident might come down. Problem is, this is a new virus, so it probably will affect a lot of people. And for it to circulate through a lot of people, the prediction, again, I don't know, there are a lot of information around, is somewhere between 50 to 75%. They say about 60-65% of the people in the earth will be affected. Not necessarily that they will be dangerously affected, but they're infected or carry the virus and so on. So to go through that number, it will be a very long time. So probably it will not disappear anytime soon, and everybody is saying that at this time. About travels, I think the travel, again, it's something you have to balance yourself. I think my suggestion will be as long as you are healthy, you are young, just function normally. If you are old, you have multiple medical illnesses, try to avoid traveling or being in crowds. Stay at home. But again, there is no solid information I can share with you. Go ahead.
I apologize if this was asked earlier, but what kind of cleaning or disinfectant procedures would you recommend for, say, our musalla or this place. So if we want to carry on normally, yes, but we want to do the disinfect, right? So if you take a place like our musalla, what would you recommend? Just like, is it a vacuum cleaning? Is it a deep cleaning that we do once a week, say before Jummah, after Jummah? And then also for any place of congregation, what type of disinfectant should we be doing as part of a quote unquote normal to deal with this going forward?
Okay, this I can answer it as a scientific matter, not necessarily as what I think is right or wrong. It's just an advice. I think the first piece is, like I talked earlier, frequent washing of handles or things which are touched by people frequently. They needs to be washed all the time, regularly, with disinfectant. That is the first thing to do. I think doors, handles, faucets, things like that, bathrooms, these really needs to be washed frequently. I talked about people if they are sick to assign an area. Again, this is just scientific discussion. I'm not sure if it is doable or not. I think having an area which is assigned for people who you think is sick, it's nothing wrong with that. It's not, they still come to the masjid, but they pray in a different area. I think the carpet is probably a problem, to be honest with you, because we put our nose there, and that's, of course, even if you are not sneezing or coughing, you probably putting some viruses there, and all of us put our heads in the same place. If it can be cleaned more frequently, vacuuming probably will not do it. If that's the question, it probably won't. You need more deep cleaning and maybe some chemicals used. And I think what also you can do, I don't know if it is allowed Islamically or not, to put the gel soap there, the sanitizer, the alcohol sanitizer everywhere, so people more frequently use it, and more tissues around. I think that will be very helpful. Essentially, the first step you can do, frequent cleaning of surfaces which are touched by the people. Social isolation, something to think about.
Can I ask a question? Dr. Moore, we have seen in China there was a start of the epidemic, then there was a peak, and now it's coming down. So do you expect that's going to happen everywhere?
Probably not. And the reason is, I think, I don't know, I'm not an expert. I've been in a lot of committees actually dealing with this. So even the experts who I talk to and mix with them, they don't have an answer. However, what China can do, nobody else can do. So that is very important. I mean, this in China, they literally can isolate a whole town. They literally do, and they force it. I mean, if you don't wear a mask, by the way, I'm glad we talked about, I want to touch on the mask. Social mask doesn't do anything. All it does is after a short period of time, it will be filled with spit or whatever, and it will be moist. And once it is moist, you are actually not breathing through it anymore. You are breathing around it, so it doesn't do anything. It is useful for example, in healthcare setting, because if you go to a patient and you are there for a few minutes, you breathe through the mask, and that works. But doing it won't help. However, if you are infected or suspected to be infected, it's good to wear a mask if you are in a group, because it doesn't necessarily, you don't breathe through it. However, when you sneeze or cough, exactly. So that's where it is useful. Otherwise, putting a mask on your face, it doesn't do anything. Just to clarify, I don't think what happened in China. First of all, you are not, a lot of people question what actually the numbers are. So we don't know if the numbers are true or not. Second, what they did, nobody I think can do anywhere in the world. The way they isolated people. So Allahu Alam. Brother wants to speak.
No, I just want to say about experience about yesterday, Friday, when I went to Al-Wali for Salatul Jum'ah, like the doctor said, the carpet, it cannot be just vacuum. So they were passing these for everybody, and they told us you pray on it and you keep it in your pocket. And if you go pray anywhere, just you don't have to put the whole thing. You can just have like this, and you pray, and when you finish, take it and leave. So it's an idea.
Well, if you can afford that, that's good.
Free.
No, if the masjid, I'm talking if the masjid can
yeah.
afford that, that's
Yeah.
good.
So, okay, just
So this is Suggestion.
So couple of points regarding the face mask. Normal person should not wear the face mask. That's not recommended. So as per CDC. So if you have the symptoms, you should wear the mask. The normal people should not wear the mask and should not panic about the face mask. Number two is then I looked at the CDC website. There is a no recommended soap or disinfectant. There's all are the normal standard whatever you get in the grocery. It's all are equally effective. But however, they gave the list of disinfectant in the CDC website. Like Clorox, we have normally a lot of people use it. Even wipes is also very effective. In terms of other things, I want to mention that if you have, if your kids have the symptoms of any cold symptoms, please do not send them to the school. That's very important. That's how you can protect. So we discussed in the morning also at the school that if you have any cold symptoms, runny nose, fever, cough, do not send your kids to the school. And a lot of people asking about the mask, face mask. So there's a misconception that if you do not have the symptoms, do not wear the mask, and it doesn't prevent. The other strange about this virus is it's spread the contact. So if you ever sneeze and hand attached, then you touch the surface, then it is spread. Like not like flu that you droplet infection and aerosol. Most of the time it by contact. So that's most important. So they said it's a 72 hours. That's why the NYC, the subway, they're cleaning it every 72 hours. That if you contact it, it lasts 72 hours in the surface. But the most of the time, the incubation period is 2 to 14 days. So we don't know how long the normal person can pass this virus. So that's
So on the surface, 72 hours. Incubation period is 14 days for human beings. Yeah. Any questions? Can I make a comment? You know, the things can get panicky. People get panic. Even governments get panic. And sometimes politically they get panic. So what I was wondering is that out of political reasons and out of, you know, panic style, if the government shuts down the stores and all those things, what is going to happen? So I was wondering that should we have a little more extra food, a little more extra medications, a little more extra cash at our home? What do you think?
No, no. Don't. This is a commercial. I guess that's what like these big companies are looking for, to panic and go buy stuff. Listen, let's make sense with the religion now. Everything in the hand of Allah. If we are meant to die starving, we are going to die starving even if the house is full of food. So at this time, there is no reason to go and, today I went to Costco to buy tissues. They have no tissues there. No water is there, but no, they limit to yeah. But this is ridiculous. Listen, I think we don't need to panic. I think as long as you have enough food for a couple of days, you are good. Cash, I don't think it. No, even if you have cash, it doesn't matter. They have nothing in the stores anyway. Oh, by the way, cash can be. It's better to use a credit card if you can. Yeah.
The Federal Reserve is also looking at the cash notes which are coming from Asian countries. They are sterilizing them. The Federal Reserve, yeah.
In China, they burn some of the money they have and they sterilize the rest. So that's another thing which China can do. I know. they don't exist anymore. A lot of factories are closed. It's true. Actually, for example, the mask. Hospitals used to buy masks which are made in China. They don't exist now. They don't have them.
Because the stuffs are not coming here. The stuffs are not coming from China. People are also scared to buy the stuff from China. So maybe next few weeks or months, you probably will start seeing it once you run out of the supplies which they have in the warehouses, because no new product is being manufactured. And you're already seeing at stores, Costco, Walmart, and other places, that dollar shop full of made in China stuff. So definitely that will be I think major concern later on with the supply, and then demand, and then cost will go up.
Yeah, I guess in Costco they don't have some of the usual Costco products. Probably they are made in China. That's why they don't have. All right.
Yes.
Yes, it start actually. Let me tell you the scientific theory, and I'll tell you the. Yeah, but that's true. That's true. However, if you might eat the same product for a long time, but if you happen to eat an animal which is infected, you are likely to get infected, and that's probably what happened. I we don't know if it is necessarily that. It doesn't have to be that. But in the market where you are mixing fresh meat with live animal, the animal which is alive, it could be infected and it spreads the infection to the meat which you are eating. So even if you are not eating that animal, as long as it is in the market, it could be spread through there. The other theory possibly is that it could have been in a lab generate happened that it leaked from a lab. That's also possible because there are a lot of studies going on all the time on viruses. Wallahu alam. So something it could be the cause too. But most likely it started from animals. And is it related to eating wild animals? This is what some people say. Allahu alam. The answer, nobody knows. Or if somebody knows, they're not sharing that information. Not necessarily in China, even outside China, nobody really know. There is a lab, they say, close to that market where it started, and that lab handled viruses too. So Allahu alam. So who knows? Probably we will never know. We, we know one thing though. This is something new to humanity. This virus, the closest thing in which they have found genetically close to it is in a wild animal. It's in a bat. It's called the horseshoe bat. That's all they know. Nobody can find any other source for it. And that means it's actually not the actual virus. It's a virus which is close enough to it, which means that virus has mutated already or changed its character to produce this virus.
Yeah, there was a news piece that Chinese government is banning eating live animals. Direct eating of the live animal.
When the virus enters the body, does it like when the virus gets in the body, let's say 10, 10, 10 viruses, then it gets much more, or it,
Okay, so the virus actually cannot replicate itself. Like bacteria, for example, it divides and replicates itself independent of the host or the body. But the virus cannot do that. The virus, what it does is attaches itself to the cell in the body and forces the cell to replicate it. So actually, itself cannot do that. It actually programs the cell where it goes to produce viruses. So that's how it multiplies, right?
Okay, Jazakallah khair, everybody, for coming. Pray from Allah and do your best, inshallah. And we can end by a dua. Hashmi sahab, dua करेंगे? अच्छा 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 चल ठीक है चल ठीक बिस्मिल्लाहिर रहमानिर रहीम वल अस्र इन्नल इंसान लफी खुस्र इल्ला लज़ीना आमनु व आमिलुस सालिहाति व तवासौ बिल हक़्क़ि जज़ाकल्लाह
There's a common instruction on the MCMC TV, our website, just a common reminders to just was how to prevent getting the infection.